First of all, what is anatomy? We're getting the language of anatomy. This is anatomy physiology. To start to answer that question, we can define the different kinds of anatomy. There's what's called gross anatomy. Gross anatomy is where you can identify structures with the naked eye. You don't need a microscope or anything like that. Identification of structures with the naked eye. Basically, you could see things pretty good if it's 1 millimeter. Okay, that's what the eye can do pretty well. If it's a vessel, like some vessels of the heart, they're like 1 millimeter, you can see them on the heart. And, well, the thing is, if you can see it, anatomists have given it a name, and it's your job to know it. Okay, that's what we do in anatomy. It's the identification of the different body parts. Okay? And so, if you can't see it with the naked eye, I mean, there's microscopic anatomy. Obviously, structures viewed with a microscope. Here's a viewed with a scope. The reason why that's important for us, I believe chapter 3 is cell, chapter 4 is tissues. We have scopes. We have a microscope lab coming up. I believe it's Monday. When you get your scopes out, you'll be able to view things at like, what is it, 40x magnification, 100x, 400x. There's even 1000x, but I never had you do 1000. Usually we need oil immersion for that, and I just don't do that in this class. It's not necessary. But this is kind of our low, medium, high mag. You know, starting at this mag here, this medium magnification, you can start to see tissues quite well, details. You could kind of see fibers and cells. When we get really into tissues, you have to be able to see cellular structures. You can barely make out cells at a 100x. When you get to 400x, you can see cells pretty good. Cell level. So that's why it's important for you to know about microscopic anatomy. As soon as chapter 3, we talk about cells. Chapter 4, we talk about tissues, because tissues are comprised of cell types. Cells make the tissues viable. We study both. Okay, so microscopic anatomy, it's basically identifying things. When it's something on a cadaver, something on a model, what is it? That's the skill. Can you identify it? Which means, can you spell it? Can you spell? I had this problem with my 6-year-old. He's in 1st grade. He has trouble on his spelling. Same problem with you guys, college students in this class. If you have problems with it, it takes practice. Okay, it's not easy. I'll try to work it out with you as we go through things. So that's anatomy. I mean, we do physiology too. Okay. I have slides on physiology coming up, but I just kind of want to move on and get into some of the terms that anatomists use so that we can communicate with each other. For you, if like say you're a nurse or in some other health field, you get a patient's chart, this language allows you to read a patient's chart, this in physiology. So. Got a picture here. This illustration is of a person standing in what's called the anatomical position. That's what I want you to define. It's a reference point. Okay, so it's like if you say anatomical position, that's this, and then you start talking about something, and the person you're communicating with knows what you're talking about because they have this as a reference point. Well, so the reference point is you're standing erect, feet together. Notice palms facing forward. Notice gaze is forward. They're looking forward. Say gaze. Gaze also forward. That's pretty much it. And just like you see there, that's the anatomical position. Okay. Now, normally, when we study cadavers, they're not standing up, right? It's lying on a gurney. And so the word, if you're lying supine, that means lying on your back. You're lying face up. Lay face up. Prone, lay face down. If you want to study something on the posterior aspect, on the back, they got to be prone. If you want to study the chest region, they got to be face up. So supine, prone, that's usually how you study cadavers, but the anatomical position, they're standing, just as a reference point like in that picture. Now, the directional terms, the anatomical directions are relative terms. You're comparing two positions. Anatomical directions are relative terms. Relative means you're comparing two things. Like if I say, I'm faster than what? I'm faster. Faster than what? I'm faster than you, faster than him, faster than Usain Bolt. You have to compare it to something. That's what this is. You're comparing two things. So the first term, let's start with that says superior, that says inferior. Let's compare those two. If something is more superior, say for example, it's closer to the head. If it's inferior, it's closer to the feet. For example, the shoulder is superior to the hip. The hip is superior to the knee. Okay? The ankle is inferior to the knee. You're comparing two things. And what if the person was standing on their head? Oh, then the feet are superior. That's why we use the anatomical position. Okay? By definition, they're not standing on their head. All right, so they got cranial caudal. Cranial caudal, it's over here. Cranial means head, caudal means tail, towards the gluteal, and we don't have tails. But obviously this is more for four-legged animals who are, their spine is parallel to the ground. Well, these terms are still used. Closer to head, closer to the tail. Okay, basically. Other terms. Zoom in here. You can see my terms better. See anterior, posterior, front and back. That's kind of the next one. anterior. Sometimes anatomists use the term dorsal, or excuse me, ventral instead of anterior. They mean the same thing. Ventral means belly side, front side. Closer to the front. Posterior or dorsal. Dorsal means back. Closer to the back. So you got front and back. You also have the other one. You know, if you look at this person standing in the anatomical position, you know, we are a bilateral organism, meaning you could put a mid-sagittal line right down the middle and create, you know, right and left halves, which are mirror images of each other. So that being said, if you have a midline and you're closer to the midline, you're more medial. If you're further away from the midline, you're more lateral. Closer to midline. Lateral. Further from midline. Okay, we have proximal distal. Notice these terms are used for the extremities. Upper extremity, lower extremity, your arms and your legs, basically. Proximal means for your extremities, whether it be upper or lower, it's closer to the trunk attachment, to the point where the extremity attaches to the trunk. For example, your arm is connected to your trunk at the shoulder. So be closer to the shoulder if you're more proximal. So proximal, I was going to say closer to trunk or torso. I think torso is a better word than trunk. Trunk could be the trunk of your car. All right, closer to the torso. Okay, so distal means you're further out, further away from the torso. You know, proximity, if something is in close proximity, it's closer. If something is distant from you, it's further away. Proximal, distal. The shoulder is proximal to the elbow. The wrist is distal to the elbow. Okay, that kind of thing. So I got a blank figure there. You can kind of drill yourself, and you know, easy questions that I could ask on a quiz or a test. Just putting letters there. Which is more proximal, X or Y? X is, which is more medial. Y is, you know, is relative terms, compare two positions. We also have superficial and deep. This is more for dissection. You should be aware of the term. That's our classic slab of skin model. Superficial is closer to the surface. Deep is beneath it. So if you're dissecting, well, the first layer you can remove is skin. There's epidermis, okay, that's skin. There's also dermis, which is considered skin, but then you have this layer here, the deep fascia. The point is, the deeper you go under the skin, the deeper you are. The closer you go to the surface, the more superficial you are. That's basically all you got to know. Superficial, deep. There's also this thing called regional terms, because there's two styles of anatomy that you could learn, AMP. One is regional, one is systemic. Let me define those. I didn't do that before. When we get into the regional terms, there's regional anatomy. This method of studying anatomy of the human body is you just go region to region. Say, for example, you want to study upper extremity. As an example. Okay. UE for short. Well, a regional approach is you study everything in that region, everything that's there. Bones, muscles, nerves, blood vessels, joints. In that region. Then go to the next region, lower extremity. You can go to the pelvis, then go to the head, then go to the perineal region. I mean, all the different regions. You study everything in them. That's one way to study. You know, the other way to study is called a systemic approach, systemic anatomy. That's studying the body by their functional. You sort them based on function. Study organ systems based on function. So as an example, skeletal system. Well, you study the skeletal system as a function, you know, provides mechanical movement, calcium storage, bone marrow, but you study the whole body, skull, vertebral column, upper limb, lower limb, all the bones, okay? And then you go to the muscular system, study all the muscles, not just in a region, the whole body, okay? That's another way to do it. Now, the reason why I mention this, you got two books that you might possibly use, and they both use different ones. Okay, I'm looking at this book. Maybe you have it already. I'm flipping to the table of contents, and it's like, oh, back, thorax, okay, abdomen, pelvis perineum, upper limb, like upper extremity, lower limb. Which one is this book arranged? How's it arranged? Regional or systemic? Regional. It's a different region, so it's like, huh. You talked about biceps brachii. It's a muscle. Where should I go? Probably upper limb. Okay. Here's the main text. Look at the chapters here. Oh, let's see. Look at chapter 5. It goes integument, bones and skeletal tissue, skeleton, joints, muscles, tissue, muscular system, nervous system, central nervous system. Which one's this? This one's systemic. So be aware of that, okay? Maybe you would have figured it out on your own. Maybe you wouldn't have, but it's good. It's good I told you. So we're going to talk about the regional terms. You got to know that. Okay, let's say, for example, you get a cadaver on the table, and it's a very obese case, super obese. But you still have to be able to tell the regions. You just kind of see this big specimen. But if you know the regional terms, you can communicate with other people in the room if you know your landmarks, you know, how to navigate through difficult cases where it's hard to see things. So we want to know the different regions. Okay. This kind of relates to regional anatomy. So this is kind of where you start to get a sense of what anatomy words sound like. A lot of Greek and Latin roots. Now, I'm not going to have you do every single one of them. A lot of them, to be clear, I'll write the ones I think you ought to know on the board. We'll start with the head. The anatomy word for head is cephalic. Okay, so head is like the layman's term, but cephalic is the anatomy word. Now there's a lot of subregions within the head, I mean, especially when you're looking at the face. I think you should know frontal. That means forehead. Okay. Again, we got to know the anatomy language, not the everyday language. Orbital region, that's where your eyeball is in, the socket of your eye. Eye socket. You got nasal, oral. Yeah, oral, let's do oral. Oral, mouth region. Okay, that's enough. Do cervical. Cervical is neck. Cervix means neck. Cervical. Now they're doing the AL form of these words, or ick or al. Like the proper way to say it is cervical region. Okay, but they're not putting that. But you know, I'll just kind of do what they're doing. You could hear someone say cervix. Like, you know, there's different forms of the word. Like this means neck too. Just you didn't make an adjective form of the word. So I'll just erase that. Just don't get confused. Basically, cervical region, that's the neck region. Okay. Before I move more inferior, let's go to the posterior view of the head. There's one word over there I want you to know. So the posterior view of the head, the cephalic region, I want you to know occipital. Okay, that's pointing to the base of the skull. I want you to know that. So basically, that will sit on top of the cervical region. Let's go back to anterior and let's look at the upper limb. The upper limb is a region, and there's many regions to talk about there. So if I say upper extremity, same thing as upper limb, the UL or the UE. And most proximally, you got the acromial region. Acromial is shoulder. You palpate your shoulder. Palpate means touch. You can touch yourself. That big bony thing you feel there, that's actually called the acromion. Yeah, we'll get to that. It's the shoulder region. We have brachial region. Okay, sometimes called the brachium, right? Same thing, just not the AL version of the word. It means arm. Brachium is arm in everyday language. Now in anatomy, the arm is the region between shoulder and elbow. Okay, this, between shoulder and elbow. The brachium is region between shoulder and elbow. Okay, distal to the brachium is the is the elbow. Now the anatomy word for elbow, there's front of the elbow, there's back of the elbow. Okay, so for the front of the elbow, go with antebrachial. No, I'm sorry, antecubital. Got ahead of myself. Antecubital, pointing right to there, this region. Antecubital, sorry. All right. Antecubital, that region is basically the front of your elbow. It's where they draw blood, right? The back of the elbow, like usually when people say you elbow someone with the bony part of your elbow, that's the back of the elbow. That's the olecranon region. Okay, distal to the elbow is the forearm, and the forearm word for anatomy is antebrachial. Forearm. In anatomy, that's the region between elbow and wrist. Now, the confusing thing in anatomy is that students confuse the brachial region and anabrachial. In everyday language, your arm is the whole thing, right? But in anatomy, it's only the region between the shoulder and elbow. Between elbow and wrist, that's your forearm. So don't confuse arm and forearm, basically. It's a common mistake. Let's move on, look at kind of the chest region. Now the chest region is basically your thorax. Yeah, right here. Well, thoracic region, also called the thorax, AX. Yeah. So thoracic, the first C is pronounced S. The second one is a hard C. So now the thoracic region. Basically, it's your chest, your rib cage, and it's subdivided. You should know the sternal region under the thoracic region. Sternal region, your sternum, is your breastplate. Okay, the horizontal breastplate right here. Most of your ribs have an attachment to the sternum through cartilage. You should know axillary region. Axillary it's your armpit. Now your armpit, when you're in the anatomical position, you don't have an armpit. You have to abduct your arm to have an armpit, so you get a tickle, right? Axillary, we'll get to that. Now, mammary is the breast area. Breast region. We are called mammals because we feed our youngs with breast milk, the mammary gland. You'll study that in recon. Okay, abdominal region. You know, the thoracic region and the abdominal region are divided by a muscle called the diaphragm. So I'll write that down. Now, diaphragm is just an anatomy word that means membrane. Turns out this membrane is actually functionally your breathing muscle. That's its function. Helps you breathe. But here, regionally, as a regional structure, it divides thorax from abdomen. Divides, I'll write that down, divides thoracic abdominal regions. Okay, well, you got the abdominal region with the umbilical region where navel is. So I'll put that for abdominal. Your navel, your belly button is your umbilical region, as a part of the abdominal region. Basically, the abdominal region is pretty much not your rib cage. Your rib cage pretty much defines the thorax. The abdominal region is the soft part that doesn't have protection by hard ribs, but by your abdominal wall muscles. Now, the umbilical region, that's all that's listed there. Know the pelvic region? You see that word a lot in anatomy. It basically means like a wide basin, a bowl, a big bowl. It's the widest part of your hips. So pelvis. We'll study the pelvis when we get there and later in the term. The inguinal region, inguin means groin, so let's write that down. Inguinal. Groin area. I mean, right next to your genitalia. Okay. Well, you know, I skipped a couple for upper limb. I think you ought to know carpus and manus. Okay. You might want to know that carpal region is wrist. Manus means hand. And there's other things listed under hand, but it's okay. We'll get to that later. But you should know carpal, manus, wrist, hand in anatomy. You should know that. Okay, before I get to the lower extremity, let's look at the posterior region, see if there's anything I left out. Posteriorly, one term that's there on the back is the vertebral region. Generally speaking, the anatomy word for back is dorsal. Dorsal means on the back. And the back is the wide expanse, covered in blue. But in the middle of it, your spine, that's the vertebral region. Your vertebra, your spine. Okay, so know that. Inferior to that is the lumbar region, kind of lower back on either side of the spine, lumbar region. Lower back, basically. And then your gluteal region, gluteus maximus, the buttocks, know that, gluteal. Put that there. It's also pointing to an area between your hips and thighs is the perineal region. It's pretty much where you have your external genitalia. That's an important region when you get to repro. Perineal region. Between anus and external genitalia, I'll put that as the definition. I'm going to continue up here. The region between anus and external genitalia. You ever sat on one of those small bike seats? The small bike seat actually kind of fits that region. Okay. Let's talk about the lower limb. Looking at the front, you know, when you put your hands on your hips like that, the hip is called the coxal region in anatomy. So let's do lower limb. Or LL, coxal, hip. And then you have the thigh, or the femoral region. Now the thigh is the region between the hip joint and the knee joint, the region between hip and knee. Okay, so then the knee itself, the front of the knee, the bony part of the knee, your kneecap is called the patella. So we call this region the patellar region. Basically, kneecap. It's a bone, and we'll look at the patella. If you look at the back of the knee doesn't have that bone there. It's kind of a, well, basically the front of the elbow is like the back of the knee, right? We have that little fossa, that little depression. So the back of the knee is the popliteal region. Back of knee. So it's like the front of the knee, bony, is like the back of the elbow, bony. Patellar and olecranon. The front of the elbow, antecubital, is like the back of the knee, popliteal. So inferior to the knee region is the leg. The word for anatomy in the anatomy word for leg is crural. And in anatomy, the leg is the region between knee and ankle. Because in everyday language, the leg, when people say you have nice legs or whatever, they refer to your whole lower extremity. But in anatomy, it's just that region. Okay, thigh is between hip and knee, leg between knee and ankle. So the word for ankle in anatomy is tarsal region. You can put it under foot or pedal region. Pedal is foot in anatomy, and under that put tarsal region, ankle. If you look at the back of the leg is called the sural region. Sural means calf, the back of your leg. Sural calf. Okay, that'll do it. That's a lot of terms. We didn't do every single one of them. You should know. It's basic language for anatomy. You should know it from the first chapter. Okay, now when you study anatomy, excuse me, check this. There's one thing you should keep in mind. You have to cut the cadaver open to view internal structures. So you kind of have to know the plane that they cut, whether it's a picture in your book or something I'm showing you in class. Usually a picture in your book. Like for imaging purposes, you can cut the body in these three planes. Let me kind of define what they are. Zoom in a little bit so you can see the planes better. See where it says median or mid-sagittal plane? When you cut in that plane, you're creating left and right halves of the body, right? So if you cut right down the middle, it's mid-sagittal. So the median plane is also called the sagittal plane. Median or sagittal plane creates left and right halves. If you cut right down the middle, that's called mid-sagittal. That term's on there. That's what they did in this example. Down the middle. Now, the one that's called frontal plane, that's also called the coronal plane. That's a term that's used, it's not there. I want you to know it. You cut in the front here. When you cut in that plane, it creates front and back sides. Frontal, also called coronal. That plane creates front back pieces. And then that one where they're cutting right in half at the waist in the transverse plane. Sometimes people refer to that as a cross section. You ever see that term? Well, in a cross sectional view, I mean, it creates, you know, upper and lower pieces, right? When you cut in that plane. So if you're doing imaging, you go into radiology or something, and you know, you got to know what you're looking at. Oh, that's a sagittal view. You're looking at internal structures. I see the spine there. Maybe you don't know what you're looking at. You don't have to know now, but you should be able to identify what plane it is. That's cutting it right in the cross-sectional view, so I can see the vertebral column and spinal cord posteriorly. You can see all the viscera, the spleen over there, and that's another way to view anatomy, to see internal structures. Transverse, and there's a frontal view. You can see the heart and lungs in there. So those are different ways to cut the body so we can kind of see internal structures. You also have movement in those planes. Okay, now here's a picture that illustrates it. Okay, that top view, these top three pictures, I should say, this is these movements are called flexion and extension. You know, they're moving. It's movement in the sagittal plane. Flexion, extension. Okay, both of these, basically I'll say movement in sagittal plane. Okay, let me kind of demonstrate that. You can see the picture there of how she's moving her extremities in that plane. I kind of call it the running man. Like when you run, your limbs go like this. It's this plane, front and back. You're moving in that plane. See my apps there? I'm going to tap on the Complete Anatomy one. That's the one you could buy. Just to give you a preview of it. I'm going to like make muscles do animation to demonstrate these movements. Okay, so I gotta throw muscles on there. Boom, layer them on. You got them all up there. So let me choose one that flexes. I'll just kind of zoom in. You tap on it, highlights it. Oh, that's the part of the deltoid. Okay, and it has a little motion thing here. Tap on that. It gives you the motion. It's shoulder flexion. Okay, let's look at that. Okay, give you a side view there. Kind of shrink it a little bit. So flexion is moving it forward. So then what's moving it back? Extension. Okay, so that's movement in the sagittal plane, right? It's not moving side to side, it's moving front and back. And we'll learn the muscles. You don't have to know the muscles now. You have to know the terms of movement. We'll get to the muscles. I just wanted to kind of give you a preview of what this app can do for you when we do get the muscles. Let's go back. Let me do a lower extremity one. Let's do, how about Rectus Femoris. Motion. Okay, hip flexion. Move the hip here. There's a side view. Flex your knee up, and, flex your hip up, and then extend back down. Flexion, extension. Flexion, extension. I chose a muscle that flexes. So in the app, notice how the muscle lights up when it flexes, because that's what it does. That's its action, that's its function. So that's movement in the sagittal plane. That's flexion, extension. Okay, stop that. Go back. You also have what's called abduction, adduction. Call it abduction versus adduction. I emphasize the capital B and D because they sound the same. Abduction, adduction. So I usually say abduction, adduction, just to be clear. Abduction, well, both of those are movement in the frontal plane, movement in the coronal plane. So let me choose a muscle that does that. Here is glutes. Gluteus medius does that. Motion. That's the front view there. So that's the front view, anterior view. See how the leg is moving directly out to the side? So when you move it away from the midline, which one is it? Move it away. Abduction, when you move it away. When you move it back together, that's adduction. Okay? So move it away, abduction, adduction. Abduction, adduction. Okay? Think of it this way. When you add numbers, you add them together. So when we bring it together, it's adduction. In child abduction, you take the child away from their rightful parents or guardians. Okay, so that's movement in that plane. Let me go back to the slide. There you can see abduction, adduction. There's other ones that are hard to illustrate using the app because there's a combination of things, but there's circumduction. That's good for ball and socket joints. It's a circular movement. You create circular movement. For example, the shoulder can do it. Like if I keep all my joints stiff and I like make a circular movement and I draw a circle on the board, that's circumduction. Okay. You could do it with my toe too. I guess you can circumduct your hip joint. Think about the joint that's moving. Shoulder and hip can do it. You can kind of do it with your thumb, which is a saddle joint, but the point is it's a circular movement. As opposed to rotation. I'll show you on the next slide. Right here. Rotation is different from circumduction. Circumduction is a circular movement like drawing a circle, but rotation is rotation around an axis. Okay, not necessarily, it's a different movement than circumduction. You rotate around an axis. In the example there, you can see when you turn your head left and right, that's rotation of the head. That's not quite the same as circumduction. Okay. They have rotation of, I guess that's the shoulder joint. Let me show you on the app rotation. That's important. Medial and lateral rotation. Pec major motion. Where's medial rotation? There it is. So this is isolating. That doesn't show it very well. But it is showing it. When the muscle contracts, it rotates the shoulder in. Like you see how the hand is turning in a little bit? It's not because you're turning the forearm, it's because you're rotating the shoulder joint up here. It's rotating around an axis. So I could probably illustrate it better. It's like, see how I'm rotating? You can see my forearm move, but it's this joint that's rotating around a joint, right? That's rotation. So if you immediately rotate, you rotate towards the midline. Lateral rotation is you pull it out. All right, so that's rotation. Okay, you guys have been sitting a while. I want to give a break, and we'll come back and lecture some more. You're not dismissed. But when I give breaks, here's how it happens. Usually 15 minutes, but I have everyone leave the room because I like to have a break too, and I want to leave, and I can't leave you here unattended. So take everything you need. I will lock the door, so if you leave things here, it should be safe. Come back in 15 minutes.